you ever feel pain while passing stools? Have you ever noticed blood in your toilet paper or in your toilet seat? Well, you might be suffering from piles or hemorrhoids. It's a very common condition where a lot of Indians are facing but hesitate to talk about it. In this video, we'll break down about the condition, what exactly it is, how can it be prevented, how can you identify it, and what is the available treatments. Hi, I'm Dr. Meghla Bharat, General Surgeon, Zymus Hospital, Bangalore. How do you identify piles? Well, piles are swollen veins in your rectum and your anus, and some of the common symptoms include pain while passing stools. There will be a sharp burning sensation or pain during and after passing stools, bleeding during bowel movements due to the pressure while passing stools. You can see blood in your toilet or your toilet paper, swelling or lump near the anus, which might be painful or irritating or itchy, mucus discharge or purulent discharge due to infected piles, feeling of incomplete bowel movements when you feel like passing stools even after going to toilet in the morning. For example, a 30-year-old software engineer sees blood in his toilet and ignores it. Weeks later, he sees frank bleeding from the anal region and he thinks it's temporary, but the symptoms gradually worsens. Piles can happen because of various reasons, including chronic constipation, where you apply pressure to pass stools, causing bulging of the veins. Obesity, where lower abdominal fat apply pressure in the rectal veins, causing it to bulge. Pregnancy also applies pressure in the lower area, causing the veins to bulge, and hormones adds to it. Sitting for long hours in your workplace, such as drivers, watchmen, students, software engineers, are at risk. Low fiber diet causes chronic constipation, which in turn causes piles. Heavy weight lifting and straining while lifting causes pressure in your anal region, which in turn causes piles. For example, a 40-year-old businessman has long sitting hours and snacks on junk food, which in turn causes chronic constipation for him and later develops blood and pain while passing stools. There are 4 grades of piles, where grade 1 includes mild swelling of the rectal veins, which is internal but just causes discomfort. Grade 2 is when the swelling is slightly bigger and comes out only while passing stools and goes back immediately. Grade 3 is when the swelling comes out while passing stools, but you'll have to push it back inside. And grade 4 is when the swelling is completely out and does not go back, and which is very painful condition. The good news is that piles is completely treatable and the treatment depends on the severity of the condition. For mild cases, that is grade 1 and grade 2, includes taking in high fiber diet, includes leafy vegetables, fruits, and whole grains. Drinking more water helps to soften the stools and prevent constipation. Avoid straining. Don't try to push your stools too hard in the toilet. Use seats bath. Sitting in warm water for 5 to 10 minutes causes relief in pain. Applying ointment and creams reduces itching and swelling. For moderate cases, that is grade 2 and grade 3, there are multiple medications such as painkillers and stool softeners that helps in the pain relief. There is rubber band ligation, sclerotherapy, where a special injection is given to the piles to reduce the size, laser therapy, where there is heat introduced into the vein and causing it to shrink. For severe cases, that is grade 4 or chronic piles, laser therapy can be used to remove the pile completely. Stapler surgeries are minimally invasive and removing the entire mass, and going with the traditional open surgeries where the entire pile is removed and more invasive. Why should you see a doctor? Well, a doctor can firstly identify the problem and to check whether it's piles or other anal conditions such as fissures, fistulas, or even rectal cancer. A doctor can suggest you the right treatment based on the severity of your condition and to prevent long-term complications such as chronic bleeding and infections. What happens if you ignore piles? Ignoring piles can lead to chronic bleeding, which causes anemia and fatigue, chronic pain and discomfort, which can be associated with infections, thrombosed hemorrhoids, when a blood clot forms in the dilated veins and causes severe pain. All these causes difficulty in everyday activity. Piles are common, but they are 100% treatable. Don't hesitate to talk about it. While mild cases can be treated and completely cured, advanced medical treatment ensures painless recovery from the severe cases.